Sure, postpartum psychosis is one of the most severe complications of childbirth, and it's one of the major causes of maternal death in the first year after delivery, unfortunately, because patients get severely psychiatrically ill in a few days or weeks after delivery. So yes, if it's detected in time, it can very well be prevented and treated, but it's key to, yeah, as I say, detect it in time, diagnose it, and then treat it. And then the prognosis is very good. Sure, because it's such a severe disorder, patients or women who have a family member who has had this are anxious themselves. What is the risk for myself? So if you had a sister who has had it, or we saw so many patients whose mother has had it, even patients whose mother deceased because their mother committed suicide as part of their postpartum psychosis. So they're really worried. So women with a first degree family member are worried. What our study found is that the risk is highly increased, the relative risk. So you have a 10 times more risk than someone else who does not have a family member. But given that it's a rare disorder, your absolute risk is quite low. It's only 1.5%. So that means that, yeah, you should be aware, but it's a reassuring message for sisters and for patients in a way. For us as clinicians and as researchers, this high familiarity tells us that, that it's a heritable condition and that we should look further into the genes and etiology. Yeah, like I said, it's good to know for women if they're pregnant themselves that if they have this first degree family member, that they are at increased risk, and that means after delivery that they, for example, make sure they get enough rest, they get enough sleep. I think that's a good idea, of course, for every woman in this postpartum periods. And also that you seek timely help or care if you or your partner or someone else sees unusual symptoms like out of character. People describe it as, I don't recognize my partner. She is so irritable, extremely weird, mood is all over the place, or she's getting paranoid, or her mood is very low and very rapidly very depressed. So basically any severe psychiatric symptom which is unusual and occurs in these 4 first days or weeks is very important to pay attention to. And that is, of course, a bit complicated because, as everyone knows, especially this audience, the time after childbirth is a time in which women's moods can be all over the place, and women have the baby blues and are highly emotional and sleep deprived. So there is a balance between, not 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 being overly worried if women have psychiatric symptoms, but also seeking timely care. And just to put this in perspective, yes, family members have a higher risk of postpartum psychosis, but that is incomparable to the risk that women have who have bipolar disorder. So that is manic depressive illness. That is a few percent of our population. So also a few percent of all the pregnant women we see. And these women have a 1 out of 6 risk for postpartum psychosis. They have also a 1 out of 6 risk for, quite severe postpartum depression. So together they have a 1 out of 3 risk at least to get really seriously ill after delivery. So for those women, if those women are pregnant, then it's very important to really make a plan how to prevent this and even start medication right after delivery to prevent this. That is what we recommend. So I think what obstetricians can do during pregnancy, is first of all be aware that this exists and ask for risk factors for postpartum psychosis. And as I said, the number one major risk factor is women having a bipolar disorder, so manic depressive illness. So that should be really like a flag for, okay, we, during this 9 months of pregnancy, we have to do something. We have to consult a psychiatrist, make a prevention plan, start medication right after delivery. And then another very high risk group is women who are pregnant from their second or third child and had a postpartum psychosis after their first delivery. So their risk is also very high, 1 out of 3. And then, also a risk group, but to a lesser extent, is those women who have a family member who had postpartum psychosis. Yeah, as I said, during pregnancy, asking for those risk factors, and after delivery, not being shy of seeking help and of consulting a psychiatrist if needed and if symptoms are severe. I think that is important. And what society can do is, of course, help women out during those first weeks. As I said, stress and sleep are triggers as well. So it's helpful if partners take overnight feedings and, everyone is a bit more aware how intense this period is for a mother's recovery, not only her physical recovery of childbirth, but also her mental health. No, I think that those are the most important take-home messages. As I said, if please ask every pregnant woman if she has bipolar disorder, because then she's at high risk, and we can really prevent postpartum psychosis. Because I want to emphasize that it can be prevented, and also the treatment response is excellent. If we as psychiatrists treat this in time with lithium, antipsychotics, 98% of our patients fully get better within a few weeks. And as I said, if undetected and untreated, that sometimes does not end well. I mean, it's a severe episode, often leading to inpatient admissions, very traumatic for everyone, and worst case scenario leading to suicide or infanticide. So we really want to prevent these cases.